Welcome to the Clear Ground Show. I'm your host, Dr. G, with a PhD. I hope everybody's new year was fantastic. I know mine was. But wow, did a lot of news happen over the last 4 days, and we'll try and get to all of it. We'll start off with the state of COVID in the US, and by that we'll listen to what Chris Hayes from MSNBC has to say and his thoughts on COVID. We'll listen to an interview from CNN and Rochelle Walensky and see what her updates have to say. We'll look at the CDC's official update on what to do if you're asymptomatic versus, with little symptoms. Then we'll talk about the CDC for the first time listing the US in general, every state as high transmission. From there, we're going to go to COVID policy. We're going to take a listen to Dr. Fauci, hear all the things he has to say. We'll talk about how the FDA just approved boosters for children, for certain children. We'll talk about the definition of a COVID death. And it's very interesting when you hear it out loud from the healthcare professionals. From there, we'll go to New York and how they're rationing COVID care by race. We'll talk about CNN, COVID, and obesity, which is a very obvious thing that we've talked about many times on the show, but it's great to see CNN talking about it too. Then we'll finally look at AOC in Florida and why this is a big hubbub. And nuclear energy is going green. We'll talk about that at the very end. All that and much, much more. Let's dive on in. For starters, I've covered de Blasio so much, I thought this was the most fitting end to 2021.
Don't go on a rant. Don't go on a rant. Victory lap dance. After 4 years of the crappiest term as the mayor of New York, the only thing that Democrats and Republicans can agree on is what a horrible mayor he has been. So, sayonara.
And good riddance. All right, let's go to Chris Hayes and hear what his revelations are on MSNBC. And you know what? I agree with some of it.
Nearly 66% of the eligible population. That has transformed the risk level and experience of the pandemic for the vast majority of those people. And of course, there are still many people, millions, who are immunocompromised or who are otherwise vulnerable due to age or medical conditions. But for the people who don't fall into that category, and we're talking about, 150 million people, maybe or more, those people who are vaccinated, particularly those who are boosted, the personal risk of being exposed to this went from something that we hadn't really dealt with specifically like this before in our lifetimes. We hadn't quite had an illness this infectious and this possible to cause serious illness to something that does look more like the flu. And the flu, of course, can still be dangerous, kills tens of thousands of Americans every year, but we don't orient our lives around the flu. So that's closer to the level of risk that, 200 million Americans or less than that are now dealing with. And then when you add in the sheer exhaustion many people feel, and I don't have to tell you this, I'm sure, because you're just feeling this yourself, many of you, with the lengths of this disruption in their lives, obviously the politics of the pandemic are just completely different than they were earlier in the pandemic.
So I actually don't agree with a lot of what he said. We've had a lot of contagious diseases before, and especially with Omicron, the vaccinated are getting the disease just as much as the unvaccinated, if not more. Just according to some data. And so that part's kind of iffy, but his general idea, he's getting it. He's slowly getting it. And I think a lot of people are getting it, especially the people that were so hell-bent on getting the population vaccinated. Now that more and more of them are getting Omicron, they're realizing, okay, everyone's going to get it. These restrictions aren't working. Let's get back to normal life. And that's good. We need more and more people to get it so we can go back to normal life. But when I say get it, I mean get the idea that everyone's going to get it, not get Omicron. Of course, the vast majority of people that get Omicron are going to be fine. If you're immunocompromised or elderly or with other comorbidities, your risk is higher. But in general, most people that get Omicron are seeming to be doing quite good. So, like Chris Hayes said at the end, and his sort of the culmination of his ideas is that let's get back to normal. We have the flu every year. The flu kills tens of thousands of Americans every year. We don't orient our lives around it. Same thing with COVID. I think he's right on the money, but are people going to let it happen? It's tough to find out. It's tough to know. The country is so bifurcated. So let's go over to CNN and see how they're talking to Rochelle Walensky.
Of the this Omicron variant, many of those cases are mildly symptomatic, if not asymptomatic, and especially among those who are vaccinated and unvaccinated. And then finally, the behavioral science. What will people actually do when people need to get back to work? What is it that they will actually do? And if we can get them to isolate, we do want to make sure that they're isolating in those first 5 days when they're maximally infectious.
So from what you're saying, it sounds like this decision had just as much to do with business as it did with the science.
Well, so it really had a lot to do with what we thought people would be able to tolerate. We have seen relatively low rates of isolation for all of this pandemic. Some science has demonstrated less than a third of.
So first of all, Rochelle Walensky is looking kind of tired, and she's just getting, the worst end of all of it. Although partially it's her own fault, but she's just getting slugged now even by CNN on basic questions of COVID policy. It's important to note that she said Omicron is mild, especially in vaccinated. Right after she said vaccinated, she said and the unvaccinated. So it's mild in everyone, I guess, or most people that don't have any compromising issues. That was an interesting statement. But then the CNN anchor really just homes in on the question of it all. Are these decisions political or are they science driven? Clearly, these decisions now are political. They're changing so fast. In fact, we're going to look at an update from the CDC from 2 days ago, and it's just changing at lightning speed, and that cannot be based on the science. The science was the same 4 days ago, 7 days ago, 2 weeks ago. The science, for the most part, has been relatively consistent. The policies have not, and that's because the policies have been mostly politically driven. As that becomes more and more clear, I think a lot of people are going to stop listening to CDC recommendations in general. And that's a reasonable and rational response as far as their conduct has been throughout this whole pandemic. Really happy, though, to see CNN hold Rochelle Walensky's feet to the fire a little bit so that there's more clarity coming out to the American people. And by the way, here are the CDC's current guidelines for Omicron. So given what we currently know about the COVID-19 and the Omicron variant, CDC is shortening the recommended time for isolation for the public. People with COVID-19 should isolate for 5 days, and if they're asymptomatic, or their symptoms are resolving without fever for 24 hours, follow that by 5 days of wearing a mask when around others to minimize the risk of infecting people they encounter. The change is motivated by science demonstrating that the majority of SARS-CoV-2 transmission occurs early in the course of illness, generally in the 1 to 2 days prior to onset of symptoms and the 2 to 3 days after. Hopefully the CDC catches on soon that they need to specify what kind of mask to wear. Let's take a listen to Scott Gottlieb real quick. He's an MD. He's on the board of Pfizer. But that being said, he's coming out and saying, hey, cloth masks don't work. Well, duh. We've been saying this for, over a year now, at least me and people that I know. I've been mentioning it on the show. I did a study on it in August. The cloth masks don't work. Again, one of the primary reasons cloth masks don't work is that the fiber mesh is not fine enough to catch COVID particles. A coronavirus particle is about 0.12 microns in diameter, and a mask like an N95 masks protect down to 0.1 microns. So, that's a little bit better, and when I say a little, I mean a lot, than a cloth mask. We've been showing clips, for the past few episodes of people saying it. Here's one more from Scott Gottlieb, one of the board members of Pfizer.
I've been looking at pediatric hospitalizations at this record high and concerned about sending my son back into a preschool even with a mask on. What do you tell parents? Are cloth masks just not good enough anymore?
Cloth masks aren't going to provide a lot of protection. That's the bottom line. This is an airborne illness. We now understand that. And a cloth mask is not going to protect you from a virus that spreads through airborne transmission. It could protect better through droplet transmission, something like the flu, but not something like this coronavirus. We have to recognize this has not been a benign disease.
So first of all, she shouldn't be that concerned about her preschooler just by the statistics of the disease. But it's understandable that she is because of how the disease has been portrayed and how we've been conditioned here in America. It has not been reasonable, to say the least. And we're going to get to kids right after this in terms of kids and COVID. But it's amazing how saying something like that a year ago would have been totally cancelable. You would have been taken off YouTube or off other channels. It's truly incredible. Before we go into kids and COVID, I just want to show you guys this map real quick from the CDC and its level of community transmission of COVID-19 by state. And for the first time, I think in ever, everyone's high. All states are high. So again, we're all going to be getting Omicron at some point, probably in the near future. Based on all the data and evidence, it seems like most of the population is going to fare quite all right. Again, if you're immunocompromised, if you have some comorbidities, you might want to take some more precautions, but everyone's going to be getting this. So get ready for what you have to get ready for. But for the most part, most of the people will fare just fine with this disease. Now let's get an update on Fauci for COVID in children.
COVID-1 clearly originated in China, and we were fortunate to escape a major pandemic. So we really had to learn a lot more about the viruses that were there, about whether or not people were getting infected with bad viruses. So in a very minor collaboration, as part of a subcontract of a grant, we had a collaboration with some Chinese scientists. And what he...
Good old Freudian slip. Had to throw that one in just for fun. And here's the one where Fauci discussing hospitalization in children with COVID.
Children are hospitalized. Many of them are hospitalized with COVID as opposed to because of COVID. And what we mean by that, if a child goes in the hospital, they automatically get tested for COVID, and they get counted as a COVID hospitalized individual, when in fact they may go in for a broken leg or appendicitis or something like that. So it's overcounting the number of children who are, quote, hospitalized with COVID as opposed to because of COVID.
What a revelation. You mean to tell me that a bunch of kids are in the hospital and hospitals test everyone for COVID, and a lot of kids have COVID, but very few of them are actually sick from COVID? Wow, it's almost like we've had that data for 2 years and we've done nothing about it. We've just sat in our hands and scared everybody and shut down schools. This is such an incredible thing. He says it so calmly, so slyly, like, oh yeah, we've always known, it's no big deal. This is a big deal. Again, like other things, you would have been canceled for saying this just 6 months ago, just 2 months ago. And now here comes Fauci just trotting it out like it's nothing. This is a huge deal, and we can't forget this. You know, we can forgive, of course, but you cannot forget. You cannot forget that this is how you were manipulated. This is how the general public was manipulated. The data have always shown that kids have been faring quite well against COVID. Dovetailing nicely with this, let's hear what the Department of Public Health Director in Illinois, Dr. Ngozi Ezike, has to say about COVID deaths and how they count them.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
Thank you, doctor. It is helpful. It's helpful that now you guys are saying it, but this has always been the policy. So it's just it's going to take a long time for the public to really regain the trust, I think, once more and more comes out about how irresponsibly COVID was displayed to the public. That doesn't change the fact that it's a highly transmissible disease, that certain parts of the population were getting hammered by it. All these things are true, but they weren't nuanced about it at all. They did everything with the broadest of strokes, and that is not how we should handle disease. In breaking news from ABC, the FDA authorized Pfizer COVID-19 boosters for 12 to 15-year-olds. So here's what the article says. In a release, the FDA also said it has amended the emergency use authorization for the Pfizer vaccine for the coronavirus to also shorten the time between the completion of primary vaccination of the Pfizer vaccine and a booster dose to at least 5 months instead of 6, and to allow for a third dose for certain immunocompromised children 5 through 11 years of age. This move prompted prominent physicians such as Marty Makary to speak out on this FDA approval. Dr. Marty Makary said on Twitter, "Dear President Biden, FDA is bypassing its scientific advisors to authorize boosters for all kids 12 to 15 next week. This is unconscionable, undermines the integrity of the FDA's standard process. Please require the FDA to put this authorization before the VRB PAC Advisory Committee for a vote." He said it's a slap in the face to science for the US FDA to circumvent the standard convening of the Expert Advisory Board. The FDA is quietly doing this because their experts previously voted it down, voicing concerns about medical harms. So he's not alone. Many doctors are speaking out about this. This is not right. One prominent doctor speaking out about this got canceled or permanently banned from Twitter, I believe. And he just went on a podcast with Joe Rogan. It's 3 hours long. His name is Dr. Malone. Here is a clip from that show. I recommend highly that everybody, if you can find the time to go watch the full 3 hours, it's an amazing conversation.
Our government is out of control on this, and they are lawless. They completely disregard bioethics. They completely disregard the federal common rule. They have broken all the rules that I know of, that I've been trained on for years and years and years. These mandates of an experimental vaccine are explicitly illegal. They are explicitly inconsistent with the Nuremberg Code. They're explicitly inconsistent with the Belmont Report. They are flat out illegal, and they don't care. And the only thing standing between us, and it's too late for many of our colleagues, including my, the unfortunate colleagues in the DOD. Hopefully we're going to be able to stop them before they take our kids.
What's wrong? What do you mean by the DOD?
The mandated vaccines for all personnel.
They're mandated for everyone in the DOD?
Yeah. What's going on in the White House is a whole another hour's talk.
Yeah, I'm sure it is.
And keep in mind, Dr. Malone is vaccinated, so he is actually one of the original developers of mRNA technology. And so he's kind of an expert. He is an expert in this field. And Joe Rogan had him on for 3 hours, and they discussed all sorts of things. Twitter banned Dr. Malone for repeated violations of, quote, misinformation on COVID. All of it seemed to me to be at least cited, and they were papers. So it's very interesting. And we'll see if 6 months from now, they're saying exactly what he was banned for, which is the whole problem with banning people in the first place. Anyways, I highly encourage everyone to go watch it again. It's extremely informative. And if you disagree, at least you can look things up. He cites a lot of his papers. He cites a lot of his studies that he takes his information from, and you can look it up. That's the best part about it. Now, many of you listening, I know, probably have had COVID or are dealing with it right now. And once you're done with it, you're done with it, and you think, hey, whatever, I can move on with my life now. Ideally, that would be the case. In this particular situation, however, you have to remain vocal when asked about COVID and your thoughts. So, for example, look at New York City. New York City is considering race when distributing life-saving COVID treatments. This is according to the New York Post. So New York City will take patients' race into account when distributing potentially life-saving COVID treatments, the Department of Health and Mental Hygiene revealed on their website. The city will, quote, consider race and ethnicity when assessing individual risk, end quote, reads the agency's official guidance from December 20th, which adds that, quote, long-standing systemic health and social inequities, end quote, can contribute to an increased risk of dying from COVID-19. This guidance applies to both the distribution of monoclonal antibodies and oral antivirals like Paxlovid and Molnupiravir. So here's a full quote. The DOH-MH is committed to improving health outcomes for all New Yorkers by explicitly advancing racial equity and social justice. Racial equity does not mean simply treating everyone equally, but rather allocating resources and services in such a way that explicitly addresses barriers imposed by structural racism, i.e. policies and institutional practices that perpetuate racial inequity and white privilege, end quote. It is unclear if the new, quote, race guidance, end quote, has yet to exclude whites from getting treatment, but observers and doctors fear that a system is being created that could lead to racial exclusion in the future during drug shortages or case surges. The reason why we have to keep speaking up on this is so that we don't end up with this situation. The article is exactly right, and this could lead to really bad downstream effects in the future. And by the way, there is no racial leaning towards COVID. COVID is more age-based and weight-based. I don't think there's any correlation with race. And so the fact that people are trying to put race into it as if race is a qualifying factor in terms of severity of illness is incorrect for this disease. Speaking of obesity, CNN released another article on CNN Health. This is the second one in recent history discussing obesity and COVID-19. The CNN article states that people who are overweight or obese are at much higher risk of much more severe disease and even death from COVID-19. Now, we've known this for over a year. For over a year, we've known this. And they're just now releasing a second article on this. So what is the actual numbers from the study that CNN is reporting from? People with obesity are 46% more at risk of getting COVID-19, according to a study from August. It found that they are also more at risk of getting really sick, facing a 113% higher chance of being hospitalized, a 74% higher risk of needing to be treated in the ICU, and perhaps most troubling of all, a 48% increased risk of death. You can read the full article. Links are all in the description. It's just amazing that they cited this from August, right? This came out in August, and we have heard nothing about weight reduction from any of the mainstream media in terms of addressing COVID and severe outcomes. All we've heard is vaccinate, vaccinate, vaccinate. It has been just it's been criminal. It's been criminal to not talk of other ways to reduce severity of illness besides just vaccination, especially when the vaccine is so new. For our final COVID story, I'm going to talk about how Alexandria Ocasio-Cortez went to Florida and why it's a big debacle. And it just happened recently. She was down there to spend some vacation time with her boyfriend. There's two main reasons why this is a major headline. Number one, she's just a flaming hypocrite. The reason I say this is she is helping drive policy like mask mandates, like vaccination passports, like isolating for just this insanely long time in her state of New York. And then she leaves her state to go on vacation in a state where none of those things are passed. There is no vaccine restrictions. There are no mask mandates. In Florida, you can just go out and go to the bar and do exactly like what she's doing. Have a good time. She's seen here, at a drag show. There's no mask in sight. She's drinking. She's enjoying the crowd. But then she poops on Florida. She just says the worst things about it. And so she's getting flack for that at a hypocritical level. Now, the second thing she's getting flack for is this tweet. If Republicans are mad they can't date me, they can just say that instead of projecting their sexual frustration onto my boyfriend's feet, you creepy weirdos. Now, she said that in response to Steve Cortez's tweet that said, 1, if leftists like AOC actually thought mandates and masks worked, they wouldn't be frolicking in free Florida. 2, her guy is showing his gross, pale male feet in public, not at a pool/beach with hideous sandals. 0 for 2. It is Twitter, and that was a jab, and it's obviously pretty much a joke, but she didn't respond to the first premise, and people are upset that she didn't. They're saying, why do you turn every criticism, and they're applying this to her in broad strokes now outside of this tweet thread. They say, why do you make every criticism against you a psychological problem? They want to date you. There's this repression instead of addressing the actual question. And that question, his number one question or his statement, is something she should address. Why is it that she's going to Florida when she has clearly been espousing the opposite of COVID policies as Florida? Why is she going there and enjoying how they've done their COVID policy and then pooping on it? It doesn't make a lot of sense, and she's getting flack for it, and she deserves it. Now, what many people aren't saying, and I do believe to be the case, is that AOC is actually a media mastermind, similar to Trump. They know how to get the spotlight, keep it on them, and keep it on what they want to talk about. And she's doing just that here. This response tweet about the Republicans dating her, it got over 175,000 likes. And it's been up for 4 days now. So she's just a media mastermind. And I wouldn't be surprised if she was, in some sort of front runner position, maybe not for president yet, but moving on up through Congress. Now with this sort of media government tie-in that we have, she is priming herself for a lot of vertical movement, even though she releases crazy, stupid tweets like this. So just be on the lookout for that. That's my prediction. For our final story, the European Union decides that nuclear is going to go green. This coming from the BBC, the European Commission has proposed plans to label some gas and nuclear power as green, prompting criticism from Germany. The proposal argues that gas and nuclear are key to helping transition to cleaner power. But Germany's environment minister called the plan, quote, absolutely wrong, end quote. This comes months after the country's pledge to keep temperature rise within 1.5 Celsius at the COP26 climate summit. If a majority of EU members back this proposal, then it will become law from 2023. France had reportedly pushed for nuclear power to be included. The country relies on nuclear energy for 70% of its electricity, although this may be cut to half over the next 15 years. France should stick with its guts here. It should not cut its nuclear power in half. I believe nuclear power is the most green and efficient way to get energy that can supply the cities and lifestyle we have right now. So I'm all for this, and I hope it passes. And with that, we'll close out the first episode of the new year. Thank you guys so much for listening. If you like what you heard, please like, please share. Let's get other people subscribing. Let's get these numbers way, way up. Remember, I have an Instagram where you can go check out all the thumbnails I post of the episode pictures. And with that, I'll be back on Wednesday, tomorrow. And please enjoy this video. See you guys then.